You got the breakfast?
I got breakfast.
I'm gonna grab, hey, Bane, honey, come for breakfast. One of the reasons I wanted to be a dentist was because I wanted to be able to take care of my family. You know, we didn't have a lot growing up. As soon as I graduated high school, I went directly to dental assisting school. Between assisting and bartending, worked my way through college and got into dental school. And I guess I just had a little bit of that entrepreneurial way about me where I did work at a lot of other practices as an associate, seeing what I didn't want to have happen. Immediately latched on to wanting to own my own business and kind of run it the way that I thought would be the best way, which is mostly, revolving around customer service and, making people happy and making people smile. What separates us is our commitment to the advancements in technology. I love to be able to convert a fearful patient into somebody who actually wants to come to see me.
Hello, how are you?
All the technology that I have in the office makes everything so much easier and so much less scary.
This is actually the iTero here, and we're going to take a quick image of your mouth.
Patients just love it. They get very excited when I can show them what the technology can do. I actually was one of the first dentists in Arizona to purchase the iTero, the new and improved one. It has an infrared way of seeing cavities without doing x-rays, and it pretty much scans everything in the mouth, and then you bite down and then it shows your bite. And that's important because if you're hitting too heavy in one area or on one particular tooth, it can cause more breakage, chipping of teeth in the front, and over time that eventually is going to break.
You got to think about surface area. So if you're just kind of grinding a little bit on your teeth, and now you're kind of like this, you're grinding twice as long on your teeth. So by kind of positioning your teeth where you're just functioning off of it just a little bit, then you end up having less wear and tear over time.
In the past, when I've said this to patients, they hear me and they understand, but when you see it on a screen and you actually see where the teeth are touching and how you can manipulate the 3 dimension of the actual scan, then you can really see what I'm trying to explain to the patient. I'm very educational in my office. It's mostly about education. It's mostly about showing the patient what I'm seeing and also showing the whole picture. A lot of dentists will look at the tooth, see the broken tooth, and fix the broken tooth. I like to say, why is this tooth broken? There's a reason why it's broken. And I look at the whole picture, and this scanner, this iTero scanner, allows me to see the whole picture. It scans for any kind of patients that want an Invisalign, if they need a night guard, if they need any kind of restorative work. I use it also to make my crowns in office.
And this is going to tell the milling unit how to design the crown.
I can take a picture in the mouth, send it to the milling unit. The milling unit cuts the strongest block, which is zirconia.
So I first put the block in here.
And that was something that a lot of dentists are unable to use. I also was one of the first dentists to purchase a CT scan, which is a 3D image of the entire mouth. A lot of times with root canals, with traditional x-rays, you can't really see a system that's inside the tooth going in blindly. With a root canal, these canals that are hard to see on a regular x-ray, I'm able to see in 3D. I'm able to see things that I wasn't able to see. So now I'm able to not have to refer people out when normally I wasn't sure if I can do the root canal. Now I can clearly see if I can do it, and I can accurately clean out the canal. With the 3D imaging, it is pretty much the only way that you can do implants now. Back when I got it 5 years ago, it was not the standard of care. Now it is the standard of care. And I wanted to do that originally before it became something that was necessary, because I knew that was the way that it was going.
Overall, your teeth look great.
I want to be ahead of the curve with this technology, knowing that this is what's going to happen.